I'm Seong from Yonsei University in Korea. My disclosure. Today, I'd like to talk about the background of developing spine robot and the basic concept and the current status. Especially, I'd like to introduce in spine robot in Korea and major obstacles to be overcome in the future. So, already 18 years ago, in 2001, the remote telesurgery was performed. The ultimate purpose of a robot is like this, telesurgery. The first alternative robotist telesurgery was performed Dr. Jacks using the robotic system JEOS. JEOS was merged into Intuitive Surgical in 2003. The surgeon was in the New York, and the patient was in the France. Gynecological surgery was performed in 2001 successfully. So this Da Vinci system, until 2015, over 700 surgeon procedures was done, and this number of operations is increasing now. This is my case for the transthoracic paravertebral schwannoma neurofibroma patient. But we know we are a spine surgeon. We can deal with a soft tissue tumor with Da Vinci system, but we cannot deal with the bone, vertebral body, because this Da Vinci system has no kind of a power or torque. So we always do like this surgery, K-wire and Owling, tapping, and screw insertion. And classically, we always do this kind of a time-consuming, labor-consuming procedure as well. But in my age of 70, I cannot do this kind of surgery anymore because I have no power in that age. So my concern, we want like this one, the robot. The robot is just the robot can do a repetitive procedure like this. This is a Tesla company, full automated car manufacturing company. So the real thing, what surgeons want is that before entering the operating room, every surgeon wants planning for operation before the day of operation like this. And then we want to do this plan transfer automatically to the operating room without my labor, just transfer to the robot system. And then we can order to put the screw from the robot. So in robotic application in spine surgery is like that, especially posterior surgery, spinal fixation, and the oncologic biopsy and tumor target and resection can be achieved by robotic spine surgery. Even though today we talk about MIS. MIS is a very repetitive and very complex procedure step. K-wire insertion, dilator, and tapping, and screw insertion, and finally we should pass the rod along the screw head. But even though we minimize the the hazard, but there is some hazard of radiation and has a limitation like relatively invasive and contamination in a long-time surgery and labor radiation. So there is a reason why and the background of spine surgery robot is invented and developed. So robotic screw insertion surgery has one accuracy, then repetitive accuracy, then decreasing the operating time, and hope to integrate AI or telesurgery in the future. So robot surgery is recently popularized. We can notice that in the PubMed search, in the robot surgery, we can put the keyword, the robot surgery and spine robot surgery. The PubMed search is very high, skyrocketed in recent days. And in business, the global market of spine surgery robot is skyrocketed until 2022, $2.7 billion of market to be appear. And until the third quarter in 2017, major robot was installed 170 in the world widely, and ROSA spine only one. And you can see the major robotics stock prices skyrocketed. It represented some popularity. But the first robotics in neurosurgery is invented by John Adler in Stanford. When I stay in Stanford, he is one of my mentors, and as the entrepreneurship, he invented the cyber knife. But the unique and very smart way is that the exercise spine tracking system, it is a real-time tracking system to real-time track the tumor and real-time track the anatomy. This is a patented system, but it needs continuous X-ray from the 2 point. So it does not decrease radiation hazard. So if the spine surgery robot can be the promise of new technology, it always has evidence over the accuracy, radiation, and clinical outcomes. Already, Dr. Jerim showed some evidence. I can say something different things. In 2005, in neurosurgery, they classified the surgical robots as 3 types. So A type is a supervisory control robotic system, and B type is a robotic telesurgical system, and C is a shared control system. So Da Vinci belongs to the type B, but spine surgery robot belongs to type C. But Da Vinci is a little bit, very, very sophisticated robot system, but if we develop a spine robot, it's very difficult, more difficult than the Da Vinci system, because spine robot needs bone work. It does not, it needs more strength, more power, and more torque. And it needs image registration, and it needs another surgery tool, and a hardware and navigation system. And for the cervical spine and some vertebral artery manipulation, we need accuracy less than 0.5 millimeters. It's a very complex thing to be overcome. In the market, in spine surgery robot, there's already 4 or 5 types of spine surgery robot was emerged. Major Renaissance, Major X, and Roger Spine, and Accessius GPS. So Major would be maybe a first commercially available robot system. And they upgraded Major X from the Renaissance system. It has more axis of robot arm and long span of robot. And the first quarter in the Major system reported that they have 32% of market sales was increased to 32%, gross margin to 58.3%. And they hope they entered the ASC. And recently, this year, 200 unit was already installed. And they extended the usage of this operation in DBS, brain operation. And ROSA spine was invented in France, but now merged in the Zimmer spine, was the one of the market competitor of a robot system. Usually the robot system has a very complex environment because they always use intraop imaging system by the O-arm or C-arm like this. Always they make us an intraop imaging matching system, like some unique system in the. This is a kind of a unique imaging matching system in the Renaissance system. By 2 shot of a fluoro system is matched with preoperative CT scan. So this is evidence of robot system until now. Already Dr. Jarim introduced this one. So the comparative study showed the robot system has better result than the freehand technique by the data, like a 90.94% versus 92%. In 2017, there is another article showing the robot system has more accuracy than the freehand group. And radiation exposure, as you expected, the several articles was reported about the radiation exposure. So there is so much decrease in the radiation exposure and the decrease in time to radiation exposure. So there is a 74% lower radiation exposure than freehand technique. But we cannot underestimate the radiation from the intraop CT or preoperative CT scan. So this article does not include that kind of things. In clinical outcomes, as you know, the robot system isn't introduced just a few years ago, so there is no long-term data. But there are just small articles about the intraop adverse event is a little bit less than the freehand technique. But most important thing is the cost effectiveness. Now, currently no studies for the cost effectiveness, but it needs always robot system needs very, very large short-term cost. So I think a few years later, the studies can be shown the cost effectiveness of a robot system. But currently, we cannot find any study about the cost effectiveness. So until now, the reason of the obstacles by the robot system is accuracy and radiation hazard decreased than the freehand technique, and the image registration and planning software is developed so well. But always we have a limitation in the robot system. Just robot system has invasive now and just guide. It cannot inserting screw and limited in the multi-level. Even though the module X was upgraded as the module X, robot arm has made the expansion of a span of surgery, allowing the multi-level surgery. And there's a surface scanner. They can avoid the collision with the patient's skin surface. But and the surface scanner is like here. But always module or other operation robot has invasiveness, skiving phenomenon, and it has only guiding system, not insertion of screws. So first quarter in the major robotics has this kind of plan. This is some kind of obstacles and they can achieved in the overcome in the future. Real-time visualization and workflow correction and no guide wire. As you know, DUPI, this is a freehand technique instrument. DUPI and Promise already developed and produced a no K-wire technique with a percutaneous screw system. This minimizes steps and minimizes trauma to the patient. But in the robotic system, next generation of robot system already will install this kind of system. So Excelsius is the latest robot system, but resolve the issue is safety. Safety is this end effector has a sensor. So sensor sensing the pressure or some movement. So if there is adverse movement, it can be stopped automatically. And there is a 3D verification system with another markers. So it can achieve the real-time tracking system, real-time tracking for the anatomy using the markers. But it has a limitation as well, multiple and complex workflow as well. So, but Gross Medical and KB Medical merged in last year because this kind of patent was obtained by KB Medical. So Gross Medical merged KB Medical because of this kind of patent. The patent is some future perspectives should be obtained in the future by the robot company. So I think that I'd like to introduce I want to make you understand these things. Always the machine has no errors, less than 1 millimeters. Already machine has very, very low reader errors, but after machine there is so much errors. If we obtain a intraop CT scan, CT image from the intraop CT scan and transport to the robot system, but if there is some movement, especially in the surgeon, skiving phenomenon or muscle retraction by tool, and if there is some motion in the patient, like the respiration and position, and some segmental motion after destabilization, it always make a virtual image, does not correlate real anatomy. So always a robot system and navigation system follows a virtual image, but it is a very important thing. It does not match exactly with real anatomy. So there is, so far there is no real-time tracking system, cool real-time tracking system. Just the Measure X, Globus X issues does not have a real-time tracking system. Just they can do a virtual image integration, but real-time tracking system is one of the future tools to be obtained. So in Korea, the similar system is developed in Korea, the first generation by QRX Incorporation. This has a base and the 5 axis of a robot arm. Already, this robot arm has accuracy less than 1 millimeters. Robot arm has a 0.58 and leader tip 0.88. And in this optical system, it is a similar system with other system. This rotational axis, 4 rotational axis, 1 translational axis, and this robot arm moves like this area. So, but basic concept and basic movement robot is like that. Just the pre-op CT scan, and you can make a target point and order to the robot system to target that point, and just a guide over the K-wire or leader or screen insertion system. But this is a primitive type of first generation of a QRX spine robot. And after that, robot retreat, and withdraw the robot arms like that. So the system is similar with this one, but we know that what is the obstacles, what is the limitation of the current robot system. So we are developing to obtain some newest perspectives of the robot system. But I cannot tell everything because there is a pending patent or some other. We are developing some tools of spine screw insertion tools, but it is pending patent. So Robin, this name of robot is Robin, and a Robin system is installed in the patient and clinician side and the other side, and like this one. And we are making the respiration level monitoring, and it can be monitored during the surgery, and you can calibrate the robot arms with the patient's respiration. But always there is a limitation of a conventional robot system, technologically complex and poor accuracy between pre-op image and the real image, real anatomy. So our solution is just simply easy operation and minimize the current workflow and the accurate segmentation and planning and strong guide of tools. So this is our animal lab in our Yonsei University. We are already developed planning software, and the robot feasibility test was done in the with dry soapbone like this. Because a year before was performed like this. And our current status is regular meeting and research meeting, and clinical demand for hardware software is transferred to the engineer, and we have feasibility test and animal lab is underwent in our lab. So unfortunately, we have OARM system in operating room, OARM 1 and OARM 2. So we are having some experiment feasibility in operating room, and with the integration of OARM image and robot registration. So always we are making a first generation of spine surgery, but we are planning the next generation. What is the next generation of robot? Always we should consider minimize the steps, no KYN, no tapping like this system. This picture shows the step of the Module X, the latest and the most popular robot system, but it needs so many steps. So it is the reason why the Module has planning to minimize the steps. And in the future, AI integration and IP protection is very important. So this is photos after MOU from the QREX Corporation, and this engineer, and I'm here already in last March. And the outlook to develop spine surgery robot in Korea is until this year, we will finish animal study and a second generation design. And until the 2019, we will got a KFDA and CE, and some patent and spine surgery tool. We will set up the spine surgery, special spine surgery tool to adapt to the end effect of the robot system. And third year, we will achieve FDA and the market launching. We are looking for the market launching in the 30 years. So in conclusion, the spine surgery robot is emerging market. And in Korea, we are struggling with Robin, with the QREX company, with the neurosurgery of Yonsei University. And now I am under feasibility test and developing this robot system. And we're looking for until 2020 FDA and market launching. But we should know the technical and clinical obstacles. Always problem is real-time tracking of surgical anatomy, and we should minimize workflow and simple procedure, the efficiency, cost effectiveness. And in the future, we are planning to AI integrate system and protect the IP. So I think the SS members, with the creative idea, you can always collaborate to develop new next generation robot system. Please contact with me. Thank you very much. I'm sorry. This is yeah. We should know that. We should know that. Yeah. Benzer told like this. The Rita says like this. So we should know the basic concept and basic skills for operation. So, and then robotic system will follow that. So thank you very much.